non-invasive positive pressure ventilation. CPAP is continuous positive airway pressure, right? Also known as BiPAP. NIV would just be non-invasive ventilation. So,
Bi-level.
I don't actually like to call it bi-level because there's an advanced mode of ventilation on the ventilators that's called bi-level. So it's actually a totally different mode, so don't call it bi-level. BiPAP. BiPAP is a trade name, so it's actually trademarked by Respironics. So you're going to hear it here as NIV or NIPPV. BiPAP is a trademark name. Respironic is the first person to make one, which is why everybody calls it BiPAP, but it's technically only the Respironics machine is only technically allowed to be called a BiPAP. So we're going to call it
test. It will be
NIPPV or NIV.
Okay.
You'll see it as either
Just
one.
double checking.
Yeah, same as your boards. I'm going to try to start getting you used to the names as they're called on the boards because they don't use anything.
Oh my God.
Yeah, well, we'll show them that. They won't use any trademark names at all. Everything is a generic name. So like the VEST, high frequency chest wall oscillator. That's the other name of it. So you'll see it as HFCWO. So, and we'll get into that. So everything's going to be listed by its generic name. So 2 pressures and 1 pressure, right? So we have IPAP. Oops. IPAP, inspiratory, positive airway pressure. And we're only going to be talking about BiPAP and CPAP use in the acute care setting. We'll talk about home care setting in 5th term, not now. This is ICU that we're talking about in everything for this class. EPAP, remember, also the same as CPAP or PEEP. Expiratory. CPAP is 1, I just put 1. It's continuous, positive airway pressure. Oxygenation only. Remember in the beginning of the term when I showed the demo with the PEEP on the test lungs, on the pig lungs, right?
Yes.
Right.
When we just put PEEP on, was there any air movement?
No.
Nope, just hold it open. So if your patient's not breathing, it's not going to do you any good. So it's truly meant to mimic PEEP, and it's only for oxygenation. So we could just put hypoxemic, respiratory failure, severe oxygenation, however you want to word it. That's it. In the acute care setting, we just don't see a lot of CPAP. We see nasal cannulas, high flow nasal cannulas, and this guy. So, of these 2 settings, let's see. J, between IPAP and EPAP, which one on a BiPAP is for oxygenation?
EPAP?
Yes. So EPAP is oxygenation. And IPAP is for ventilation. You guys have a slip on this, don't you?
Yeah.
You do
Yes.
BiPAP? Okay, good. Everybody's good with everything so far, right? All right, I'll review. So, let's see. So let's talk about indications. I'm gonna say pH less than 7.35, but greater than 7.2. Greater than or equal to 7.2. CO2 could be really anywhere depending on your patient. Because if they're a chronic retainer, your CO2 could be really high. So it's going to be the combination of the two together. Because if your CO2 is high but your pH is normal, it doesn't matter, right? Because your patient's compensated. So this is one time you're going to want to see the two together. So CO2 probably greater than 50. If my pH is greater than 7.35 and in the normal range, your patient's compensated. They really don't need a BiPAP. So less than 7.35, but greater than or equal to 7.2, because if we get less than 7.2, what are we doing? Intubating. Yep. And then we'll just put diagnosis related. We already know this, COPD, CHF are most likely candidates. Contraindications. Who does not get a BiPAP?
Not spontaneously breathing.
I'm not going to rule out an asthma. This is a, who did not put it on? I'm not going to rule out an asthma.
Someone with apnea.
So apnea,
Nauseous.
nausea, can't protect their airway.
Unrestrained.
Dynamically unstable.
Yep. ALOC, altered level of consciousness. Get used to seeing that.
Yeah.
Hemodynamically unstable. That one's kind of iffy. Sometimes the patient needs it to become hemodynamically stable, but you just have to watch. So,
Facial trauma.
oh yeah, for sure. Facial trauma, inability to remove the mask.
Is that under the compliance thing, like you kind of, if they can't remove the mask, is that more of like they don't understand what's going on?
No, if they're at risk, they're gonna aspirate if they can't remove the mask.
That would fall more under temperature. Because, well, I mean, kind of in the
Let me
fact that
give
they
you-
can't remove it to protect it. But.
Yeah, but it's still just
But I
kind of
know
like
it's a separate
solicit, so
thing.
everybody understands.
When we think can't protect the airway, we're thinking about like
Swallowing, or they don't have an intact, yeah, gag reflex, things like that. You will see doctors that want to restrain a patient and put them on BiPAP and leave them in their room by themselves. Don't be part of it. Tell them that you refuse to do it. I have a recent grad who had to do it. I'm very serious when I say that. You tell the doctor that you won't do it. There are going to be times when the doctor's going to tell you to do something that's inappropriate. This is one of them. And they will try to do it. And you will tell them no. And if you have to, you're going to get your clinical supervisor, you're going to get the educator, you're going to get the manager of the department. It's a high risk. You're putting your patient at risk. You're putting your license on the line. Do not do it. Tell the doctor if he wants that patient to be on BiPAP, he will have to do it himself. That's one of those times you have to stand your ground because it's totally inappropriate. If your patient's in a monitored, very closely monitored environment and they're restrained, or they have a sitter in the room or things like that, that's okay because somebody's there. I'm talking about leaving a patient in the room by himself on a BiPAP with restraints. That's a no. Nick?
But being restrained, there's another thing, is if he needs to take it off and the person that's watching him doesn't know they need to take it off, like, oh, I'm gonna throw up. Oh, no, keep it on, keep it on, keep it on. He's restrained. Nothing.
No, the people in the room are told what. That's the whole point of them being there. So I don't know, Sharon. What's your experience with that?